All right. Well, again, welcome. I'm Wayne Staub, and I have the pleasure of being the Chief Business Relations Officer here at NJBIA. And we're very happy to have our presentation today, Hiring and Firing, How to Improve Worksite Wellness by Going Tobacco Free. And it's brought to you by some of our partners listed here. We couldn't do it without them. Robert Wood Johnson Barnabas Hospital, Association Member Trust, Citizens Bank, Focus New Jersey, Manufacturing Counts, Minding Your Business, NJBIA Support Center, the New Jersey Business Magazine, and Planet New Jersey. Well, I'm very happy and excited to present to you our presenters for today, Monica Hanna and Ashley Smith. Monica is the Assistant Director for the Robert Wood Johnson Barnabas Hospital Institute for Prevention and Recovery Nicotine and Tobacco Recovery Program. She currently oversees the largest state-funded tobacco quit center across 6 counties, including Middlesex, Mercer, Ocean, Monmouth, Union, and Essex County. She also leads the system-wide strategic planning and implementation for tobacco cessation services. Ashley is the program manager for tobacco projects at New Jersey Prevention Network. Ashley has been in the field for prevention services since 2017 with credentials as a certified health education specialist. Her passion is to help reduce exposure to secondhand smoke, reduce youth access to tobacco products, help those who do smoke or vape to stop, and to drive statewide and local policy changes. Just a few housekeeping matters before we get started. Today's webinar is being recorded, and we will email you along with today's presentation within a week. So be on the lookout for that. I'd also like to draw your attention to the question tab. Monica and Ashley would be happy to take your questions. So get them in as they come to you via the question chat box. So with that, without any further ado, I'd like to turn it over to Monica and Ashley. Please take us away.
Great. Good morning. Thank you so much for that introduction. Again, my name is Ashley Smith, and I'm the program manager for tobacco projects here at New Jersey Prevention Network, co-led by Tobacco Free for Healthy New Jersey. Monica, if you'd like to introduce yourself again.
Sure. Thank you so much, Wayne and Ashley. Monica Hanna here. I am the Assistant Director for the Tobacco Quit Centers with RWJBarnabas Health. And we are happy to be here with you guys and share these awesome resources that we have across the state.
Great. So welcome to our webinar, Improve Worksite Wellness by Going Tobacco Free. Go Tobacco Free for Health and Savings. So Monica, I will go over the objectives with everyone. So some takeaways that you hope that you can get from today's presentation are to understand tobacco-free policies for worksite wellness, to understand the financial and health benefits of worksites going tobacco-free, and to learn how to access free tobacco cessation resources across the state of New Jersey. So again, like was mentioned, if you have any questions, comments, anything you'd like to share, please put it in the Q&A, and we'll be happy to answer any questions throughout the presentation.
Thanks, Ashley. And because we're co-facilitating and co-collaborating on this webinar, we want to dive a little bit in and give you guys a background about each of our agencies and what we offer. So I work for the Institute for Prevention and Recovery, and our institute is a leader for substance use disorder. We focus on preventative and recovery support services. We are a public health agency providing support across various programs and sectors. And we've been providing these services for over 30 years across the state of New Jersey. So we have a lot of experience in the addiction field, providing treatment and preventative. Ashley, tossing it to you.
Great. Thank you, Monica. So Monica focuses on that cessation, quitting, stopping piece, and our agency really focuses on the prevention and the education piece and the policy creation. So Tobacco Free for Healthy New Jersey, we are New Jersey's largest collaborative effort to reduce the health consequences of tobacco use. That does include vaping and the harms from second and third hand smoke exposure through prevention, education, and cessation in all 21 counties. Monica will speak to you a little bit later about secondhand smoke and third hand smoke. So Tobacco Free is co-led by New Jersey Prevention Network and the Cooperative. We have funding from the New Jersey Department of Health, Office of Tobacco Control and Prevention, and our team engages with local coalitions and public health advocates to promote tobacco-free initiatives through our 19 regional prevention coalitions across the state of New Jersey. Here's just a little image of our statewide structure so you can see it. New Jersey is not the largest state, but we are very densely populated. So we do have partners scattered throughout the state to really help us with our work that we're doing. We are divided into 3 regions, North, Central, and South, because Central Jersey does exist. So we cover that region. Our northern team at the Center for Prevention and Counseling covers those 7 northern counties. Myself and New Jersey Prevention Network covers the 7 central counties, and we have partners at Atlantic Prevention Resource that covers the 7 southern counties. We do again have our statewide partner at the Cooperative and our statewide training partner for Lindsay Meyer Teen Institute. So if you're located in any of those regions, those are the agencies that would help you and support you with any policy or education that you are using at your workplace. We're here today to specifically talk about our Worksite Wellness Initiative. We do have a lot of different programs that we do offer, but specifically with Working Well, our mission is to reduce the health consequences of tobacco use, and again, the harm from second and third hand smoke exposure in the workplace through prevention, education, and then comes in Monica with our cessation piece. We have our vision being to aspire to promote health and wellness along with tobacco-free policies in all 21 counties of New Jersey. And our vision is a world in which no one has to worry about being exposed to second or third-hand smoke in the workplace. Everybody has the right to breathe in fresh, clean air. So how can we help workplaces? We'll dive in a little bit more about benefits and policies of going tobacco-free, but we're here to help you create those policies or strengthen existing policies that you have in place already. We can provide presentations to staff to introduce new policies and offer tobacco education. We can equip your workplace with connections to New Jersey's free cessation services and free outdoor signage and resources and materials and giveaways, and also offering different incentives to share with staff.
Ashley, we did get a question that came up.
Oh, great.
Is this something that can be legally added to a firm's employee handbook to not smoke around a certain perimeter?
Yes, absolutely, it can. And I'll go into a little bit more detail about that of exactly a good, better, and best policy. But yes, legally, you can change your policy, you can update it. That's what we're here for. So thank you for that first question. We're really excited to kind of dive in more with everyone. We know the Clean Indoor Air Act right now with you cannot smoke inside buildings, but it has to be 25 feet from a door or place of entry, but we're here to hope that you can enhance those policies and create stronger ones and share it with your workplaces.
Great. Ashley, along that lines, we have another question. How can I find out what my tobacco-free policies are?
Oh, great. So you can reach out to upper management. Everyone has an employee handbook. It should be in your employee handbook. You can speak to upper management, your human resource department, anyone else that in leadership role that can provide you with this information. It should be available to all staff to see in their handbook. But that's something that you can take a look at and then see if there's a way you want to enhance it. Monica, do you have anything to add?
Yeah, I was gonna just along those lines. I also think sometimes for maybe smaller organizations who might not have like a full robust HR system, or maybe an up and coming business who are developing their policies on their own, you may not even have a tobacco policy, right? So like maybe it doesn't actually exist. So if there is nothing in your agency, which is very possible, right? That is where we can also come in support. So Ashley's going to dive into all of it in just a few, talking about the policies, what it looks like, how we can make potential changes, what we can actually adapt and enforce, and how to support the employees throughout that process. So we'll dive into it. But yeah, if you don't have anything, we can help you create it. If you have something, we can help you revise it. So we're there to support both parts.
Thank you.
Of course.
Great. Thanks, Monica.
All yours.
Thank you. So we could talk about the financial impact on businesses. So again, everybody thinks, the WIFM, what's in it for me? Going tobacco free, what is this going to do for myself, for my employees? I know there's been such a big culture around worksite wellness as a whole in all aspects, mental health, physical health, emotional health. So we're here to provide that extra tier of what you can do. So when you think about the financial impact, annual healthcare, so this is for New Jersey stats, annual healthcare expenditures directly caused by tobacco use is $4.72 billion. So that's a lot of money. Then when you think about smoking causing productivity losses, that's $8.9 billion of productivity lost. And medical cost caused by smoking, $1.25 billion. And then per your employee, so this is on a yearly, so loss in productivity yearly is $1,760. And excess medical expenditures is $1,623. And a smoker's average number of missed work days per year is 6.16. So encouraging your staff to go tobacco-free for the individual, for the workplace really does help boost, more days in office, stronger work ethic, less people getting sick, stronger, healthier people, because we know that smoking kills more people than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined. Smokers miss twice as many work days due to acute and chronic illnesses as those that do not smoke. And again, $1,890,000 is the annual amount that average adult smokers would save by quitting, which also is $2,840 in annual savings from reducing smoking by 1 pack per day. So going tobacco-free makes sense for businesses. It can improve the health of employees and save companies money by increasing profitability and productivity and lowering absenteeism and maintenance costs. So just briefly sharing about the Smoke-Free Air Act. In 2006, the indoor public places and workplaces across the state were made smoke-free. So you cannot smoke inside any building. So looking back, if you remember those times where people could smoke in restaurants and smoke in airplanes and in offices, that is no longer allowed. And then in 2010, we prohibit the use of electronic smoking devices in indoor public places and sales to minors. So when we talk about being tobacco-free, we talk about all devices and all words in tobacco and smoking. So combustible cigarettes, nicotine pouches, smokeless tobacco, also electronic nicotine delivery systems. All of those would be included in a policy to help strengthen it. And in 2017, New Jersey law prohibits the sale of tobacco products to any person who is under 21. So you must be 21 to purchase all of these products. And in 2022, prohibit smoking at certain public places. So that was under the revision in the bill. Smoking is to be prohibited in following locations like racetrack facilities, facilities used in sporting events, ambulatory, recreational facilities, amusement parks, marinas, historical sites, burial sites, natural areas, and boardwalks were also prohibited. So what do we mean when we say going tobacco-free, going smoke-free, 100% tobacco policy? A lot of different language that you can use. So just for us to show you an example right here, some language and some definitions of what a smoke-free policy is. So a smoke-free policy is aimed at benefiting the health of the non-smokers by reducing secondhand smoke or vapor exposure. So we talk about, right, those are the same. Smoking cigarettes, vaping, smokeless tobacco, we want all of that eliminated. Then you can get a little bit stronger and go to a tobacco-free policy, which eliminates loopholes that inadvertently increase the use of other forms of tobacco, such as nicotine pouches, snus, or chewing tobacco. If you want to go a little bit stronger to have a stronger policy, that's when you can move to 100% smoke-free policy. So employees must be smoke-free in all indoor areas, including company vehicles. So smoking is restricted within a specific distance, typically a minimum of 25 feet from the entrance, like we mentioned earlier, windows and ventilations or intake to prevent smoking from drifting back into the building. So anywhere that it can get back inside to where people are in the workplace. And then our strongest policy option and language to use is a 100% tobacco-free policy. So employees must be tobacco or nicotine-free in all indoor and outdoor areas, including company vehicles. Tobacco and nicotine users must leave company property to use any tobacco product, including smokeless tobacco and electronic nicotine delivery systems. So this is just some different language that you can use when trying to create a policy.
Ashley, just bring up a point that somebody brought up when you look at cost to the business. They also feel that the cost of cleaning windows, carpets, all of that, also increases, for the business. I just wanted to point that out that somebody brought that up. Thank you.
Oh, thank you so much for bringing that up. That's really a perfect segue into what we're about to talk about right now. So you're right, we're so many benefits to going, but also that lower risk of fires, accidental injuries, reduced cleaning and maintenance costs. Those are all things to consider. So thank you for bringing up that point. When we talk about additional benefits is reducing absenteeism. So like I mentioned, smoking costs businesses an estimated $1,760 in lost productivity per smoker per year, and smokers on average miss 6.16 days of work per year due to sickness and illnesses. So reducing cleaning and maintenance costs, exactly what was mentioned. So there was a survey of cleaning and maintenance costs among 2,000 companies that adopted tobacco-free policies. 60% reported reduced expenditures. And then we have lower risk of fires and accidental injuries. Tobacco-free businesses have negotiated for lower fire and property insurance premiums, with some businesses winning reductions of maybe 25 to 30%. Then you have increased employee health. Like we said, health and wellness is just a huge part of being in the workplace and what we strive for. Everyone benefits when the air is cleared from secondhand smoke. So a 100% tobacco-free workplace policy is the only way to protect workers from second and third hand smoke. So smoke-free workplaces also help people encouraged to quit smoking. So it helps you and it helps the individual. And then also reduce potential legal liability. So non-smokers harmed by secondhand smoke at work have won lawsuits and disability claims against their employers under a variety of legal remedies. So when more workplaces go tobacco-free, more homes do as well. So I'll get into a little bit about the process. So you're sitting here and you're wondering, okay, you're telling me that I can create these policies and the benefits and how it can help me and my employees, but what do I do? Where do I start? First thing that you can consider doing is setting up a task force, then gather your information, then write your policy, then you need to announce your policy, then you need to offer help to your employees. You can't just say, oh, we're creating this policy, you can't smoke, it's done. We want to make sure we have the resources and the availability for people to help them quit and not just say, you can't do this here, goodbye. We want to give them services and resources. And again, that's what Monica will go into a little bit later. Then after you offer help, you want to prepare your work site, and then you want to monitor it.
So we did get another question. It might be for Monica. Monica, if we have employees who do want to quit, do you come to their facility and help with counseling and education?
We absolutely can. So it would be on like a as needed basis or facility basis. I mean, every program is different. There's hundreds of, not hundreds, but there's a lot of resources in New Jersey that offer supportive services. So for our specific program in our Quit Center, if there is a group of individuals, we've done it in the past where they are a lot of smokers on site, a lot of people who use tobacco products and struggle with tobacco addiction. If we work with the HR department, which is what we've done in the past, or their supervisor, we can come in on site, we can provide some services to them, provide them with free medication. So we will go over that and the accessibility, how to engage people and your employees or yourself in these services.
Great. Thank you, Monica.
You're welcome.
Great, thanks, Monica. So our first step in setting up a task force. So you really want to include smokers and non-smokers, as well as management to oversee the implementation of the tobacco policy. You want to make sure that everyone is represented when you're setting up your task force to then go through these steps. Then you want to gather your information. So get data from the employees through surveys, individual interviews, needs assessments, in order to set up priorities for the new policy and to learn about the employees' concerns. You really want to just do a check on what your employees want, what are they looking for, what are they concerned about. Then you want to actually write the policy. So the tobacco policy should be clear, simple, and include all forms of nicotine delivery systems. So don't forget to include an enforcement component that consists with other policies, because you can have a great policy in place, but you need to make sure you have someone there to enforce it so that everybody is following the policies and the rules that are there. Then you need to announce the policy. So using multiple forms of communication, send a notice to staff to share that there will be a new policy coming, train the appropriate staff on how to handle questions and concerns so that everybody is kept in the loop throughout the entire process.
Ashley, we got another question that just came up.
Okay.
Could a company fine an employee for not following set policies? And how do others handle this?
So it really depends on the policy that's in place. If that's something that's in your policy, then it needs to be followed by the individual. Again, we really want to be there to support the people that are using, to give them the resources to help them quit. So yes, there are policies that you can put in place that maybe are stricter and harsher, enforcing fines and other things like that. But we want to make sure that we have an outlet for people to go to get cessation resources and to get quit resources to help them stop. So there are any means of policies that you can create, but it's just at your discretion, again, at your workplace, what works best for you. What works for one work site might not work for another. But to really speak with us too, we're here to help to provide the resources to help you create that kind of best scenario policy that really benefits everyone, but doesn't hurt the people that are trying to quit, to give them resources. So Monica, do you have anything to add on that?
Yeah, I think you hit the nail right on the head. One of the things that we do try to take a look at when we're looking at a policy lens or even a tobacco treatment lens, and I'm going to dive into this a little bit too. From anyone who may not have smoked or maybe has smoked in the past or used tobacco products, it's easy for us to take a look at someone who does smoke and say, ew, that's gross. Oh my God, it's annoying. And you have all of these thoughts in your head as you pass someone who smells like cigarettes or see someone who's vaping. But in the real world, tobacco is actually an addiction, and it should be treated like a chronic condition because it is. It's something that they're fighting and battling even years after they've quit smoking. So, similar to a way when somebody has diabetes or heart failure, if they're not taking their medications or if they're not doing something that they should to manage their health, we wouldn't necessarily penalize them for that, right? We would just kind of help guide them or provide them with the resources and the tools. So this applies here as well. So finding people, if it is part of your company policy, that's something that they would have to adhere to, obviously, or if it's being reinforced. But what we find to be some of the most effective policies are non-punitive policies, because you're providing support services for somebody who's struggling with a chronic condition. And that's the lens that we want to encourage everybody to kind of look at from a different angle. It's maybe something that you're not used to, maybe something that you haven't looked at it before, but you're really trying to provide support services to say, hey, there's other things here that we can do, other avenues. I know obviously there's a lot of people who actually smoke that want to quit, which we'll talk about those stats in a little bit. But it's the support services, I think, is what people are really looking for more than anything else.
Great. Thanks, Monica. And that really, again, segues into offer help for another step in, getting your process to do it. Monica is here, her team is here across the entire state to offer those quit resources that are available. Because again, we don't want to just say, this is a policy, you're out of luck, figure it out on your own. We want to support everybody that we can. Then prepare your work site. So post signage that states a new policy, move or remove any smoking receptacles, provide resources such as the quit line or the quit centers, and then hold a kickoff event the day that the policy goes into effect. Something that we'll mention towards the end of the presentation is on November 21st is a Great American Smokeout. So again, too soon to make a policy or create anything, but maybe start having that conversation with your staff and your employees on what can we do to enhance our policies, and then monitor it. So designate a person on the committee to track how the policy is going. Managers should report questions, concerns, or infractions to this person. Okay, and I know it's probably a little bit challenging to see here, but we can provide handouts and anything after the presentation for everyone as well. Kind of a little checklist for you to see, here's a good policy, here's how we can make it better, and here's our best policy option that we can go about. So in New Jersey, smoking inside the workplace, it is prohibited. However, many individuals continue to be involuntarily exposed to second and third hand smoke because of the unclear or the absent tobacco policies that are in place. So best policies also have no exceptions. Smoke is smoke. So whether that's marijuana or cannabis smoke or tobacco smoke, there's just certain resources for those who are interested in quitting. And we can provide this to you to see where your policy falls on the scale. And so I'll just mention that the different ways that it can be a best policy. So full compliance with New Jersey State clean indoor air laws. So that's right there. That's your baseline. That's what you want to have. But then you want to have written policy banning tobacco use at the workplace that applies to all employees, clients, contractors, visitors, and vendors, anyone that's going into your workplace. Then we want to provide education on the impact of tobacco use with the purpose of raising awareness of the effects of tobacco use. So my team can go in and provide you with all of the different types of products, how they affect people, the data, the stats, what's in them, education on them. And then Monica and her team can go in and provide that cessation piece on how you can quit. So you have all the resources and all the education at your disposal. Provide systematic referral system to cessation resources. That includes the quit line and the quit services and any other information that's available throughout the state. And then conduct analysis of health insurance benefits for coverage of effective tobacco dependence treatment. Then you want to inform your employees about health insurance coverage or programs that include tobacco cessation, medication, and counseling. Offer employees subsidized tobacco cessation counseling. Display no smoking signs with access to the tobacco-free worksite policy. Again, we'll get into it a little bit later, but we do provide all of our signage and materials and resources for free. So the actively enforce written policy banning tobacco use. We would like you to provide incentives for being a current non-user for tobacco and for current tobacco users who are involved in cessation class or actively quitting. We know everybody loves a good incentive, right? We always say, if it's free, it's for me, right? So you have the benefit, you have the resources really at your disposal. So we're here to just make sure you know about them so that you're aware. Some people might not be aware of how much we have to offer because they haven't thought about it or thought they needed it. And then adopt smoking restrictions that go beyond New Jersey state law. So beyond that 25 feet of a door or a window or ventilation that can get inside of the building. And then the last piece I will cover before turning it over to Monica is our Working Well Tobacco-Free Toolkit. So we encourage you to go to the camera on your phone if you have it available to you, if you have a phone, to scan the QR code, or you can go to our website that's linked up at the top. We have all of our resources. If you scroll all the way to the bottom of that page, you'll be able to put in your information and download our toolkit. So everything that I mentioned to you today is in that Working Well Tobacco-Free Toolkit. It also gives you a checklist and, this is where I should be 5 weeks out from adopting my policy, or 3 weeks out, or 2 weeks out, kind of keeping you in task with everything that you need to do to make it as simple and as seamless as possible so that you can adapt a policy, have your staff follow the policy, be able to enforce it, and create a tobacco-free, healthy, safe environment. So now I'll turn it over to Monica to talk about the cessation and quitting piece and some other great information.
Thank you, Ashley. So this is a perfect segue because in order to really understand why it's important to have these policies, Ashley went over the financial impact that it can have on a business and also the health impact that it can have on the employees in terms of productivity and making sure that we have a safe environment for our workplace. But we really want to understand the numbers really first, because how much it impacts people across the state of New Jersey, but also the health impact that is associated with tobacco use. We did talk a little bit about how it is an addiction. It is a chronic condition. It is something that people struggle with. So we're going to go over some numbers and maybe play like a little game with some of them. There's just like a couple of them. So go ahead, next slide, Ashley. So 755, almost 756,000 people. Guess what number that is or what it represents. You can feel free to put it in the chat. I'll give you guys just like a few seconds. It is a pretty large number, so think wisely about what you think that number could be in relationship to. And if you don't want to put it in the chat, that's okay too. Non-smokers, monthly deaths. Okay, good. These are all really awesome guesses.
Annual deaths?
Annual deaths. Okay. So go ahead, Ashley. You can click it. Okay, so these are the number of New Jersey residents who are still smoking. So it's a very large number. So these are New Jersey residents across the state, right? Now you're thinking about the subset of people who are smoking within your agency or within your organization. So keep that number in mind. And then next slide. And with those number of people that are still smoking across the state of New Jersey, there's nearly 500,000 people every year that die from tobacco-related illnesses. So that is a massive portion of that number that we just showed you. And these are not necessarily, right, like smoking causes health impact over time. So it's not necessarily something that you see right away. I'm not going to have my first cigarette or my hit for my first vape and then die tomorrow. But this is something that happens over an extended period of time, which is why we see those call outs, loss of productivity. We see those things coming up along the road. So you have things like chronic obstructive pulmonary disease or COPD directly related to smoking, heart disease, lung cancer. And on the next slide, you're going to see 12 different types of cancers that are linked to smoking. Over here, that mouth and throat cancer, esophageal cancer, stomach cancer. So these are all different types of chronic conditions that are directly linked to tobacco use. And many times, secondhand smoke and firsthand smoke can also cause almost an equal amount or the same health impact, I should say, as firsthand smoke. So you're not only thinking about the people who are smoking, but you're also considering the people who are non-smokers in your agency to be able to provide supportive services across the board. So you're providing support to people who are actively struggling with tobacco addiction, and then you're also offering support to people who have never struggled with tobacco addiction, but maybe are exposed to it. Next slide. So this goes into the three components. So I'm pretty sure a lot of people maybe not have heard of third-hand smoke, but if you haven't, we're going to talk about it a little bit. So first-hand smoke is obviously somebody who is smoking themselves. They are inhaling the tobacco smoke, vaping, using tobacco products, chewing tobacco, whatever their choice of tobacco product may be. And then secondhand smoke is someone who may be a non-smoker or could be also an active smoker, but they're being exposed to it as the person who's smoking around them. So they could also be inhaling these toxins from these tobacco products as well. And then you have third-hand smoke. So third-hand smoke is actually all of the smoke that goes into your hair, your nails, your walls, your carpeting. We talked about reducing maintenance costs for those who smoke. Or have you ever been on an elevator with somebody who just had a cigarette and came back from outside of the building, and now you're stuck in a confined space and you can smell the cigarette smoke on their jacket or on their clothes? That is considered third-hand smoke. Or if you've stepped into somebody's car and you notice that it smells like smoke. So all of the toxins when you are smoking, all of those chemicals, and there's 7,000 chemicals in cigarette smoke, that gets seeped into the fabrics and you are still breathing it, even if the person is not actively smoking in that environment anymore. And even the smoker themselves, the person who is smoking themselves and struggling with tobacco addiction, they are also still breathing it, even if they are not smoking. So it is really anything that falls onto the outskirts, your jacket, your clothes, material things around you, the walls, or if you've been to someone's house and you take a picture of a painting off and you can see a little yellow stain around the painting from all of the tar. So that is third-hand smoke. Next slide. So we mentioned earlier, and this part is important. First, I'm going to ask you guys, what do you think the 70% means? 70% of what? Like, what does that number represent to you? And you can take a little bit of a guess. Give you guys a couple seconds to do it. People who want to quit. Yes, good job. Great job, Wayne. So 70% of people who smoke want to quit. We talked earlier, and Ashley had mentioned earlier about providing supportive services, and someone had asked the question about fining somebody for smoking, right? We've worked, I want to just give this like quick example. So Ashley and I had worked collaboratively with one of our municipal offices here in our counties. Our teams worked together, and they had a policy on their campus to reinforce fines for smoking on campus. And they ended up revamping their policy and including it to be non-punitive, that if they do get a fine for smoking on their campus or on their grounds, they are also offered cessation services as an option to waive that fine. So 70% of those smokers actually want to quit. So fining them when they're really, really trying, but it's a hard addiction to beat. And in some cases, it is more addictive than heroin or cocaine, because it is such a strong addiction and the withdrawal is incredibly quick from nicotine addiction. So we want to be able to really look at it, like I mentioned, from a different lens, that it's okay to want to enforce policies. You should be enforcing them, but also making sure that it is catering to individuals who are already struggling. So each year, over 50% of adults who smoke do try to quit, but sometimes they're just not successful on the first attempt, which is okay because they're learning every single time, which is why programs like what we have here in the state of New Jersey, all these cessation programs and prevention programs, are there to guide people throughout that process. Next slide.
So Monica, we do have a question, and it does take a little bit of the other side of it, right? So we have many employees who smoke. They are uncomfortable with the idea of going tobacco free. You know, what do we do? Do you have suggestions on how you deal with employees who are pushing back against these policies?
Yes. So I've been on that side of the spectrum. I've been in an agency when they started a tobacco-free policy, and you had a lot of pushback, and then you had some people who were like, yes, finally, this is happening. So, and Ashley's going to jump into, I'll toss it to you, Ashley, after I answer this, but it is natural to have pushback. It's going to be a natural part of the process. It is a policy change that does affect somebody. However, once we create the policies to really talk to the individuals, you're not stopping it right away. It is a gradual process to get to where you need to be. First, you've got to take a look at the policy that you have now. Then we take a look about how to revise that policy and support people who do need to quit smoking or do need those supportive services. And then we instate those supportive services. So we say, hey, in like 4 or 5 months, we plan on going tobacco free. And I want to prepare you guys for this transition. And by doing so, here are supportive services as we start working towards that policy change. So during that period of time is when Ashley's team can step in. They can provide the signage. They can sit there and kind of, I guess, prep your staff in some ways, help you prepare your employees to get to that place of comfort. And then during that period of time, they don't have to wait for 4 or 5 months to seek help. We're here anytime. So you can get the cessation programs involved at any point during that time period to start the interventions and provide them with supportive services so they feel more comfortable. Ashley, is there anything that you want to add to that, or?
No, I think you covered it. I think just to really hone in on the fact that we don't want to blindside anybody, right? You don't want to say this is happening and get on board. I think including everyone in the process and making them feel like they have a voice and their concerns and their worries matter will make a huge difference if everybody is going at it together and you have the steps throughout so they're all aware of what's going to happen and that they want to be supported and we want to support them.
Perfect.
Thank you.
Thank Thank you. And so as we are transitioning to a tobacco-free policy, or we're thinking about it maybe in our agency and organization, we're not only thinking about the benefits that it has for the agency itself, like cost savings, productivity increase, but we're also thinking about the health benefits that it has for people who do smoke. So even if someone has been smoking for 10, 15 years, if they stop smoking, they can see immediate changes in the body. Even like 20 minutes after somebody quit smoking, their heart and blood pressure decrease. So you can see the heart rate return back to normal, and then your oxygen levels return back to normal. So the body has a really beautiful way of recorrecting itself in some ways. And then you might see smokers coughing. So that way it's like expelling a lot of the toxins that they've built up over the years. And there's so many benefits that you can see down the road, which would then hopefully, the goal is to really improve the outcomes of your employee health and wellness, especially as we are moving towards this employee wellness generation, mental health, physical health, and making sure that we are protecting our employees so they can be with us for as long as we need them to. And as long as they want to. Next slide. So this is really what I want to kind of push, right? It's not, I want you guys to really think about tobacco as an addiction, tobacco use as an addiction, because it is. So there's 3 components to addiction. You have a physical component, you have a behavioral component, and you have your psychological component. The physical cravings, like I'm stressed out at work, I need to go out for a 15-minute break and I need to have that cigarette. I need to do it. It's just 15 minutes of my time. And then I can come back and work. And it's something that you really have trouble fighting, the withdrawal symptoms. Then you have the behavioral, where, I'm just bored, or I typically go outside for my lunch break. I have my lunch and I like to have my cigarette after I eat my lunch. Things that you can replace. And that's something that we come and help with. We come and help provide alternative coping strategies for people who are struggling with tobacco addiction, to say, okay, well, you have it every morning with your coffee, or you have it on your drive to work, or you have it at work during breaks, or it's taking away time from you finishing your work because every few minutes you're out on a cigarette break. What can we do to support you in that? And what can we do to replace those coping strategies? And then you have the psychological impact, right? That's the dependence. That is your brain saying, I'm smoking so much that my dopamine levels, the stimulant in my brain, right? It's causing an addiction. Every time that I have nicotine, I intake nicotine, my dopamine levels increase, which makes me think that my brain is being rewarded and my body is being rewarded for smoking. So essentially, how do we change that? How do we rewire your brain? And there's medications, there's things that we can do to support you through that process. Next slide. So like we mentioned, stopping smoking is not just for the positive physical outcomes of health outcomes of stopping, but there's also mental health outcomes that we want to look at. And we did mention that most people who do smoke or use tobacco products, they actually want to quit, 70% of them. So that is a large number. And most of those people have tried to quit on their own before, either cold turkey or with medications, and they just haven't been successful in long-term cessation. So we want to be able to support them. It's also a common belief that smoking helps you relax. But what we know, and based on the research, is that a lot of times when people are not smoking, or they think that it's helping them relax, it's really their withdrawal symptoms. So withdrawal symptoms actually can mimic very much so anxiety, depression, agitation, like being fidgety. And if you're thinking about times when you've had like a stressful situation, those same feelings would emerge to the surface, right? So it's like, I feel anxious, I feel stressed out. What can I do to help? So these are actually signs of withdrawal as well, but someone who is inactively using tobacco products, they might not be able to differentiate the two. So it does actually increase their anxiety and increase their depression over time. And quitting smoking increases the odds of long-term recovery. So if there are individuals who may be using other substances, or if there's individuals who struggle with any other kind of addiction, quitting smoking at the same time as that can actually increase your long-term recovery from all substances. So that is also an important part to consider as well. Step, and every try counts, right? So you got to quit smoking. Anyone who has tried to quit on their own has have about like 5 to 7% success rate in doing so cold turkey. But when we are combining cessation services, that rate can increase by 2 to 3 times, depending on the length of time that they're involved in the program, what kind of supportive services they're receiving. But it's important to be able to incorporate and integrate those two. But 5 to 7 times is on average of how many times it can take someone to actually quit smoking. So we want to make sure to be able to provide them and be patient. You're not going to have someone who's going to, you're not going to put this policy in place and they're going to quit tomorrow. It doesn't work that way. But what it does work is that, they can always come back to these services 4, 5, 6 times to get the support that they need throughout that process. Next slide. And how do tobacco treatment medications work? So there are 7 FDA approved medications. Next slide. And these medications are provided for free, the patches, lozenges, and gum as part of our tobacco quit centers. And then there are prescription medications like the Nicotrol inhaler, the nasal spray, varenicline, or bupropion. These are prescriptions that can be provided to them by a doctor or a prescribing provider, which we also have on our team as well, that can make sure that the person gets the medication that they need and that best suits them during their quit journey. But it is free to the patient. And if you have insurance through your company, most insurance companies do cover these medications. So that is also another alternative for that patient as well. Next slide. And so we want to go over the tobacco cessation resources. So this is where the nitty gritty is, right? Like, how do we provide these support services? So New Jersey has very, very robust tobacco cessation programs. We're actually very happy to have that. And we have quit centers, which I think only just like a couple other states have quit centers. So it's really beautiful resources. And honestly, without the funding, we would not be able to, from the New Jersey Department of Health, we would not be able to provide these services. So Moms Quit Connect is one of our services across the state of New Jersey, and the criteria is listed below. We also have the New Jersey Quit Line, which is available to anybody across the state of New Jersey, but you have to be 18 years or older. And then Quit for Kids is also another service that is available for people who want to quit smoking, or they can also text Quit for Kids at the number listed on the screen. Next slide. And then here are a few flyers from some of our specialty groups. And there's also the New Jersey Quit Centers. So I'm going to go over that one first. So in addition to the resources that we just shared, the Quit Centers, there's 11 Quit Centers across the state of New Jersey, all the way from South Jersey to North Jersey. And it's not available in every single county, but if there is a county that is neighboring one of the areas that are covered under the Quit Centers, they can absolutely provide supportive services. I'll go over in detail about what our program provides, and most of the Quit Centers provide very similar services with free medications and treatment as well. And then we also offer statewide supportive group services. So we have youth-facing treatment groups. We also have LGBTQ plus groups that are active. And then there's also Spanish speaking groups and recovery groups that are under our Quit Centers, which I'll talk about in a few. Next slide. So our nicotine and tobacco recovery program with RWJBarnabas Health, it is an 8-week program, and we do provide free supportive services to anybody who is struggling with tobacco addiction, regardless of what age they are. If they are under 18, we don't provide medications, but we can provide free patches, free lozenges, free gum to anyone who qualifies for it. And qualify means you have to just be over 18, and it gets delivered directly to their home. So it is free. We don't go through insurance. We don't bill the patient for the service, because we are fortunate enough to have this funding through the Department of Health, New Jersey Department of Health. Next slide. And if someone wants to enroll in services, so if we are working with your agency, maybe it's hard to get everybody on the same schedule for us to come on site and do a group. Or maybe the patient is like, the employee is like, I don't want to be part of a group. I'd rather do this one-on-one. And they want to schedule it on their own time. So they don't need a doctor referral or anything. They can self-enroll. So they can go to our landing page, fill out an appointment request form. They can call us, leave us a voicemail. We check it every day, but we do work remotely. So you will get a voicemail, but we check it daily. And then we have our email address as well that you can email us. And that is also checked every single day. So any of these avenues, someone can get in touch with one of our team members and we can make sure they get connected to a certified tobacco treatment specialist who will be there to guide them throughout that quit process. And that will be their person that they will be working with throughout that entire 8-week period. If they need more support beyond the 8 weeks, we can absolutely provide them with supportive services beyond that. We also have appointments that can be made either in person or Zoom. Or by phone, depending on the patient need. And we do have group or one-on-one counseling. So it really depends on the patient need and what they come up with as an agreement with their counselor. Next slide. And then here's the extended group support that I was talking about earlier. We have Spanish-speaking treatment groups. We have 2 Spanish-speaking specialists on our team that can provide groups as needed. They can also provide one-on-one counseling for Spanish-speaking individuals. And if there's any other languages, we do have a translation line that we can utilize to make sure that the patient is getting the right services that they need and navigating their care. And next slide. And every Monday night, we also have free recovery support groups. So these are not necessarily treatment groups, but they are support groups. So every Monday, 7 o'clock, anybody can join. They don't have to be part of the program. They can jump in and they can just get support services from other individuals who are going through the same experience, people who are smoking or non-smoking, and people who maybe have quit at some point when I say non-smoking, and just there for support or relapse prevention. Next slide. And then action planning. So I'm going to toss this over to Ashley. So what are the next steps? What can you guys do? And what are some of our takeaways, which I'll close out with?
Great. Thank you, Monica. So like Monica mentioned, we want to focus on 3 components. So promote tobacco-free cessation counseling and provide educational materials to raise awareness of the effects of tobacco use. So anything that we can do, again, Monica has her services that are free and available to all New Jersey residents that can do that. We want to develop a systematic referral system to New Jersey cessation resources, such as the New Jersey Quit Line, such as the NJ Quit Centers and all of those subgroups that are also available throughout the state, like the Moms Quit Connection and the LGBTQ plus groups and youth groups and all of that. We want to provide incentives for being a current and non-user of tobacco for tobacco cessation users who are involved in cessation classes or who are actively quitting. It's like Monica said, 70% of smokers are looking to quit, and it takes on about 5 to 7 attempts to quit and stay quit. That's why we're not going anywhere. So we're here and we're available. So as much as you need to utilize us, we're here for it. The other component is we want to restrict tobacco use, comply with the state Clean Indoor Air Act law, 100% smoke-free indoors, no wafting of smoke into entrances beyond 25 feet of buildings. We want to focus on have a written policy prohibiting tobacco use at the workplace, actively enforce a written policy banning tobacco use, display signs, including no smoking signs, workplace signs with information about the policy, so everybody is aware, nobody is blindsided by the information. Smoking restrictions that go beyond the state law would be great, best policy scenario. Requiring distances from entrances, and then outdoor smoking restrictions to designated areas only, or nowhere near the premises or in cars or other locations like that. And then we want to improve health benefits, our goal of today, right? So analysis of health insurance benefits for coverage of effective tobacco dependence treatment and/or prescription or over-the-counter medications. We want to inform employees about health insurance coverage or programs that include tobacco cessation medication and counseling so that they're aware of everything that's available to them. To provide health insurance coverage with no or low out-of-pocket costs for prescription tobacco cessation medication, including nicotine replacement, and provide subsidized tobacco cessation counseling. So also wanted to share, coming up on November 21st is a Great American Smokeout, a great opportunity for you to start the conversation with your employees and your employers if you haven't yet. Great American Smokeout takes place on the third Thursday every year in November, this year on the 21st. Tobacco-free theme is breaking up with big tobacco. So we encourage you to share this information. Look on our website. We have a lot of different initiatives and programs and a lot of Great American Smokeout resources that you can share with your businesses and workplaces. Again, our toolkits, and there's a Great American Smokeout toolkit. So taking a look at that to maybe take the first step can really open the conversation with your employees and your employers. Then I also just wanted to lastly share what you can get for free. Again, all of Monica's services are available for free, and our tobacco-free services. Thank you to New Jersey Department of Health, Office of Tobacco Control and Prevention. We have signage. We have big metal signs, Breathe Easy signs that we've recently updated to provide the cannabis leaf on there as well. We have tobacco-free Worksite, big metal signs we can deliver right to your location. All of Monica's quit services and quit centers that she spoke about. The Working Well Tobacco-Free Toolkit is available to you. You can network with other working well professionals, what's working, what's not working, an opportunity to collaborate. Medications are also available, as Monica shared, educational information and presentations tailored to your organization and your employees. Now I will turn it over to Monica for her takeaways.
Thank you so much. So essentially, these are our main takeaways from the presentation today that we want you guys to kind of think about and start those conversations. Like Ashley said, Great American Smokeout is coming up. So it's a great time. So businesses are shifting to support employees' overall health and wellness. So we really want you guys to start looking at it from that perspective and making sure that we have services available to our employees for extended support. And when we start the decision-making process, we want to integrate our stakeholders. That could be internal or external. It could be leadership. It could be people who are using tobacco products, maybe working with departments who may have a higher volume of people who smoke. But making sure that we have support across the board and we have the right people around the table to make sure that we're providing a policy that really supports every employee. And then access to free resources across New Jersey. So just a reminder that NJPN and Ashley's program, we offer free resources for policy change. We also offer free resources with RWJBarnabas Health, as well as other tobacco cessation programs across the state of New Jersey that are completely free and provide free medication. And medication is not cheap. So take a look at those health and wellness policies. Take a look at your benefit policies as well, because sometimes insurances do hit you with a tobacco surcharge. So here at RWJBarnabas Health, we've also incorporated that into our health benefits policy. So they have the option to waive it if they quit smoking through our program. So there are so many things that you can do and get creative with it to support the services, but we are so happy to be here with you all. And this is our information. Feel free to email us, find us on social media, but we are very accessible and here to help. Thank you so much.
Ashley and Hannah, thank you or Ashley and Monica, I'm sorry. Thank you so much for this presentation. We really enjoyed the conversation. A lot of questions have been asked and answered, and we truly appreciate it. Any last thoughts or words real quick before we depart?
Thank you for this opportunity and for allowing us to share our resources. We are available to everyone. Please utilize our free services. Email us, Facebook us, Instagram us, whatever you can. We'd like to help enhance your businesses and workplaces to be tobacco-free, to live healthier, strong, longer lives. So thank you again for this opportunity.
Monica?
Thank you so much. We just appreciate the platform to be able to share this resources with you all and be part of this. And we are happy to support each and every one of you guys throughout that journey. It could be a complicated one, but I mean, it's easy with our support. So we're happy to help.
Great. Well, again, thank you. Thank you for helping keep New Jersey healthier. We appreciate that. Two quick shameless plugs. One, we do have a handbook clinic tomorrow. that is free to members. It's on our website if you want to attend. And also, as a member of NJBIA, you do have access to our support center, which does allow an opportunity to help build a handbook. You still need the advice from these ladies to help get it to where you need to be, but we also help provide the services to get you started. With that, I just want to mention our next program is Future Proof Leadership, Women Leaders Shaping the Next Generation Workforce, and that's on November 19th. Again, want to thank all of our partners, our fabulous presenters, and just a reminder that everybody will get the presentation later in the week or next week. That's all the time we have for today. Thank you, everybody. Be healthy. And if you need help stopping smoking, we have 2 resources right here for you. Thank you.
Thank you so much.
Yeah.